Hello, welcome to Jack's Endless Review. I come to you this day to bring this topic, diabetes mellitus type 1. What is diabetes? Diabetes simply means high sugar in the blood. And it can be type 1 or type 2. But today, I'm just going to be discussing diabetes mellitus type 1. When we talk about diabetes mellitus type 1, we are looking at the patient is born with the disease, diabetes mellitus, which means the patient is having dependence of insulin. What happened here? This patient's pancreas creates natural juice, and that natural juice is called pancreatic enzyme. The pancreatic enzyme breaks down food. When the patient eats anything, it is this natural, these pancreatic enzymes that breaks the food. This juice travels through your pancreas via the ducts. They empty into the upper part of your small intestine, and which is called the duodenum. Then your pancreas is supposed to make about 8 ounces of digestive juice, which is filled with the enzymes. So this is the process this pancreas, takes in order to produce insulin in our body. But for this patient, type 1, is depending on insulin because the body is not producing enough insulin. So it depends on insulin in order to be able to talk, walk, do activities, and the rest of it. Diabetes mellitus type 1 is usually diagnosed in childhood. It's also caused by an autoimmune response. The cells are starved of glucose since there is no insulin to bring it into the cells. And one complication of this type 1 diabetes is called ketone acidosis. The cell breaks down protein and fat into energy, causing ketone to build up in the blood, and it's called acidosis. What is the signs and symptoms a diabetic type 1 patient will have? Number 1, the patient can have what is called, I use the mnemonic tired, T-I-R-E-D. T for tachycardia, I for irritability, R for restlessness, E for excess hunger, D for diaphoresis. I use this mnemonic in order to be able to discuss the sign and symptom. And this sign and symptom is also known as hypoglycemia. These are the signs that a patient with type 1 will be having when he has a low sugar in the blood. Is hypoglycemia. When he has a high sugar in the blood, is hyperglycemia. The sign and symptom of hypoglycemia I've just mentioned. The patient will be feeling so tired. He will be having all the signs that shows that this patient needs some sugar in the blood, because there is none. And that will make him to either be conscious or unconscious. When a type 1 diabetes mellitus patient is conscious and is having low glucose level, you give the patient juice or soda with carbohydrates like toast bread. This will help the patient to revive and come back to life. When he's having hyperglycemia, it means that he has too much sugar in the blood. And the sign and symptom will be 3 pp's. The patient with hyperglycemia will be having polyphagia, polyuria, polydipsia. This means excess pain, excess thirst, excess hunger. Polyuria, polydipsia, polyphagia. The patient will be having these signs because he has too much sugar in the blood. These are the signs and symptoms of hyperglycemia. If you need more of this, please make sure you like my video and subscribe. I'd like to see your comments. Thank you and God bless. Bye.